Hey guys, welcome back. Today I have my good friend here, Cesar Moreton, and I wanted to introduce him and have him tell us a little bit about what he does. I've been for a long time talking about first aid and being able to manage traumatic injuries as the second half of self-defense. I've been talking about that for a long time. And when it was time to put my money where my mouth was, I hired Cesar to come and teach us these very important skills, and I thought that you guys would get some benefit from understanding a little bit more about this. Hey Cesar, why don't you go ahead and tell them a little bit about what you do and a little bit about yourself.
Thank you first of all for having me, Tony. My name is Cesar Moreton. I'm a firefighter paramedic here in South Florida. I've been a paramedic and a firefighter and an EMS for about 17, almost 18 years now. I also happen to teach at a school called American Medical Academy, where we teach LPNs, nursing, we teach paramedic and EMS, EMTs, and just recently we've got into the tactical medicine field, where we've been teaching SWAT operators and tactical medicine. And what we've started now is to downgrade it from not only law enforcement and police officers, but we're trying to get down to the civilian level where we can hopefully teach someone that's injured or that's involved in some sort of traumatic injury or assault how to treat themselves or their loved ones on a moment's notice. 911 is always accessible, thank goodness, United States where we live. You can call 911 and the average response time is anywhere from 4 to 6 minutes. But in that 4 to 6 minute gap, there's a lot of things you can do to help yourself, to extend your life until medical professionals can get there and get you to definitive care. So that's where we're at. That's what we're trying to do. We're trying to get out there and show people that you don't have to be a paramedic, you don't have to be a nurse, a doctor, an EMT to be able to provide some first aid and some life-saving help to anybody in your family or yourself in the event of an emergency.
Well, during the course that you taught us, you mentioned something that was very interesting, which was that EMS will not be allowed into the scene until it's been secured. Correct. When there's been some type of a shooting or some type of a crime.
Correct. In our atmosphere, in the life we're living right now, in the world we're living in, we're seeing a lot of what's called active shooter situations.
Right.
Where unfortunately we've been seeing in schools where there's an active shooter, someone that's posing an immediate threat, and they're still actively posing that threat. As a EMS professional, when I get that call on my radio and dispatch to an active shooter call, as much as I would love to and my crew would love to make entry into a school, the house, the structure, wherever we're at, to provide first aid and advanced medical care, if that active shooter, that active threat is still there, we cannot make entry. Law enforcement doesn't just go barging doors in and going to neutralize that threat either. They stop, they set perimeter, they make an assessment of that threat, and that takes time. So if you're inside that structure, mall, school, house, vehicle, and you're injured, all that time is taken away from your life. All that time is taken away from time where you could be getting first aid. So you need to be able to help yourself or help your partner or whoever's in that situation.
Right, and you introduced us to some very valuable tools during the course, namely the tourniquet, which we were very impressed with. And in years past, we were all taught that the tourniquet was the last recourse.
Correct.
And I think that now, since we've been seeing so much stuff and we've been learning much more, that now we have a better sense of where it's appropriate. Can you tell us a little bit about
that? Absolutely. In the past, many years ago, I was taught that if all else fails, apply a tourniquet, and the tourniquets are not necessarily the best course of action. Due to the last 10 to 11 years that we've been seeing our conflict in the Middle East, tourniquets have been saving lives of our troops for quite a while now. We're seeing a lot of troops coming back, unfortunately missing limbs, but alive. In the past, in other conflicts, for example, the Vietnam conflict, large percentage of the soldiers that were killed there would have benefited from rudimentary tourniquet systems. A lot of police officers, and we're targeting police officers specifically, are issued kits like this right here, an IFAC, individual first aid kit. They're given to them, or they provide it themselves, they purchase it themselves, and they place it in their vehicle, and they never even open it. They don't know what's in it, but they just feel better because it's there. If they become a little bit more intimate with them and know that this $26 piece of equipment, a CAT tourniquet system, could be applied to you, and anytime you have any type of arterial bleed or injury, and it can extend your life and save your life, dramatically increases your survivability from injury. A simple tool like a tourniquet system is extremely important to have. And it's not expensive. You'd say, well, medical equipment is so expensive.
Yeah, but what's your life worth, right?
Absolutely, but you're still going to have the people that are like, well, I don't really want to spend that money. It's a $26 piece of equipment, which, by the way, I'm not selling, Tony's not selling. This isn't our product. This is a product that you can find on the internet, and many like it. and you can purchase it. You don't have to be a professional medical personnel or law enforcement. You can just purchase it, have it. The thing is getting trained on it. Once you buy something, it's great. You bought it, it's there, but unless you're trained on it, just like firearms or anything else, you might have a bunch of them, but if you don't know how to use them, you might even do more damage.
Yeah, I think that's the ticket. I think having the knowledge of how to use the tool is absolutely essential. A tool without the knowledge is next to useless. In fact, I talked about tourniquets in my Maximizing Your EDC Part 3 video where I showed how to do an improvised tourniquet. And in the video I said I don't generally plan to improvise. The reason I don't generally plan to improvise is that I pack one of these things where I have easy access to it. I do a lot of hiking. I spend as much time as I can in the outdoors, and you know, where I live, it's not easy to get to. So I try to spend as much time as I can. And sometimes we're actually in quite remote settings, and the ability to stop bleeding, should I stumble and impale myself with something in a dangerous area, I think it's very, very important. So it's not just for getting shot or stabbed or some of the more romantic notions.
Absolutely.
I mean, it could be something as simple as you fall down a flight of stairs and fall into something sharp and it pierces your leg, and now you got to stop some bleeding.
Absolutely.
So yeah, no, I found that to be very, very interesting. You covered three aspects in the course, which was the quote unquote sucking chest wound, the heavy arterial bleeding.
Correct.
And we talked about wound packing. Is that like the big three that we should be?
Pretty much blood loss, airway management, basic airway management are the big combo. Stop the bleeding and start the breathing is basically the way we say it. We want to make sure if a person is having some sort of arterial bleeding, it does us no good to restore their airway or give them oxygen, because all they're going to do is spill it onto the ground. Right. So we want to address any life threats, initial life threats. What we consider for law enforcement or for the civilian market is initial life threats would be arterial bleeding, spurting of bright red blood that can kill you fast. So what we'll teach in this course is direct pressure, elevation, and then tourniquet application. Tourniquet application as fast as possible will increase your survivability tenfold.
So it'll keep the blood.
Absolutely. Once we keep that blood in the pump, in the system, then we can go to maintaining an airway, or if you have a chest wound where there is a sucking chest wound, like we call it, how to seal that up with simple equipment, also sold all over the world online. These are like the Asherman chest seal, for example, very inexpensive piece of equipment. It's basically a sticker.
Yeah, I was very much impressed with that. This device is essentially, it is a sticker, and it's got a little piece where it burps, and it's the easiest thing. I was very surprised. In years past, they taught us to put some type of a plastic with duct tape.
Correct. Inclusive dressing.
And inclusive dressing, right?
But now they sell these products that are accessible with Halo System and Asherman chest seal. It's basically a sticker with a piece of gauze. You wipe down the injury site, place it over the injury site. It prevents air from going into the thoracic cavity and causing more problems, and it allows air to escape the thoracic cavity. Not allowing for more problems to develop. But these are things that are very easily used, very easily taught. But if you purchase them, or you have them, or you just have them there and you don't train, and that's what we have with the IFAKs. The law enforcement community might purchase these IFAK kits, have them in their vehicle, and many times I speak to law enforcement officers and I tell them, "Where's your IFAK right now?" And, "Oh, it's in the trunk." Well, if you get into an engagement right here in your vehicle, are you going to have time to get into your trunk? Are you going to be able to get into your trunk? Or are you going to get off the X, which is what we call it? We want to get off that X, get to some cover or safety, and then start taking care of your injuries until rescue gets there. Oh no, I have it in the trunk, or I have it somewhere, I'm not sure where it's at, or I don't even know what's in it. So that's the problem we have.
Yeah, again, it goes back to training and then being familiar with your equipment. Being able to deploy it is a big deal too.
Absolutely, and we offer all that. We offer it at the highest level in a TC3 course that we'd like to keep it for law enforcement and medical operators. We have it now in the LEFRS course, which is for law enforcement, safety, security officers, contractors that go off overseas.
Sure.
Whether it is for security or contractors that go overseas to do construction work, fire work. There's a lot of firefighters that go over there to work as firemen.
But basically, somebody with a security license, like the guy that works at the mall, could potentially take
Whack and Hut security operators, anywhere that works at a mall, at a housing development, school security guards.
Right. Okay.
All those would be perfect candidates for the LEFRS course. It's a simple 12-hour course, over 2 days, where you'll get a basic understanding of the anatomy of how blood loss and airway compromises will kill you quickly, and how to correct that as fast as possible and get you to safety, get you to 911.
Excellent. Is there anything else that we should be discussing?
No, I just we're truly trying to get out to the market again. American Medical Academy is an accredited college, but we're really big on quality. We teach paramedics, EMTs, LPNs, and now RNs shortly. But our quality is what we're really big on. We're not big on the quantity. We want to put out good care, good education. And at the end of the day, this course, the big target to this course is if we can help law enforcement or the security personnel or an individual help themselves, give themselves aid, or their immediate loved one or partner that aid before 911 can get there, or in the availability that 911 is not there. I think that's one of the biggest things that we want to really get out there. So
you mentioned something earlier that I wanted to touch back upon real quick. You said to extend the available time, and I think that's like a really important thing to note. In a moment where this type of stuff is needed, an increase in time could exponentially give you an increase in survivability.
Absolutely. We talk about the golden hour when we teach
paramedics, I remember that.
And EMTs, and when we teach trauma in general. From time of injury to time of definitive care, we want it to be in that hour. We want that hour to go no further than an hour from injury to definitive care. And definitive care is not the arrival of 911. Definitive care is getting to a surgeon or a trauma center where they're ready to address directly the injury or the trauma that you've incurred. So if you can extend that time where you can give yourself some aid before 911 gets there to stabilize, before you get to that definitive care, if there's something that I tell you I can offer you, we can offer you, I think it's just a no-brainer. It's a no-brainer class. It's something to give you peace of mind. It's something to give yourself peace of mind when you go on vacation. I just came back from a road trip with my family. And a lot of the times we were in the middle of roads in Kentucky, Ohio, those areas where I'm not familiar with the 911 response system there. If I'm in anywhere in Florida, I know I can get 911 rather quickly. You know, on the East Coast anyway, you know, if I'm not on the Everglades or anything. You know, I know metropolitan areas have rapid 911 response. But if I'm in an area where I'm not familiar, if I call 911 and they say, okay, well, we'll be out there in 15 to 20 as soon as we can get a unit available, if there's something that I can carry and some equipment and some knowledge and education that's going to help me extend and help save my family's life, I think it's a no-brainer.
Well, what would be the minimal equipment that you would consider for an emergency kit for managing trauma, I should say?
Number one, education.
Right.
Number one piece of equipment is the knowledge on how to use these things. Number one. The second thing I would really be is an IFAC kit. They sell them set, something with a tourniquet, something with some gauze, some hemostatic agents to stop bleeding, and a chest seal. A chest seal of some sort, either an Asherman or a Halo system would be great. In this course, we'll talk a little bit about airway adjuncts, like a nasopharyngeal airway. There are some contraindications to that. That's why I'm saying people buy an NPA, for example. It's called a nasal trumpet, goes in the nose, and it's a secondary way to patent an airway. There's certain contraindications that if you don't know,
that might
you could kill somebody. If there's any facial trauma, if there's any possible basilar or skull fracture, I know we're getting a little bit extended here, and you're not aware of that contraindication, you could kill somebody. So again, knowledge, and it's a very simple way to teach you. You know, if there's any injury in here, we're not using that.
Well, how long is a typical course?
The LEFRS course is a 2-day course, 12 hours. The first day anywhere from 7 to 8 hours. The second day is half a day, 4 hours, and that will include all the PowerPoint presentation, a lot of interactive training. We're looking to use Tony for some hand-to-hand combat that you'll see that'll get you tired out, so you can get a little stressed out before you do your hands-on the next day, and then a lot of real-life scenario training.
And again, guys, it goes back to the concept that I've been telling my students for a long time. The first aid is the second half of self-defense. This stuff goes hand in hand. I could get into a situation where I have to defend myself against an armed assailant, and I might win that scenario, quote unquote, at the moment, and then bleed out later. That's a Pyrrhic victory. That's not what I want. I want to be able to go home at the end of the day. So that's very critical. Another thing I wanted to mention for the audience was the course that Cesar did for us, this was an absolutely incredible course. I was really surprised with the amount of equipment that he brought for added realism. We dealt with stuff that was put on the person where his intestines were hanging out. There was blood coming out. There was.
It's very necessary.
Yeah.
In all my training, even when I train paramedic personnel in the program at American Medical Academy, I'm known for realistic and stressful scenarios. It does me no good to teach you over and over in a lab setting where the lighting's perfect and you're comfortable and everything's laid out for you. But in the real world, that's not how it's going to happen. So we stress you to the highest amount.
Yeah.
We show you, we put you in situations where you're going to be stressed out, you're going to be taxed out, and then we have you perform.
I enjoyed that. I enjoyed that quite a bit. I found that to be a confidence. It is very, very important. When I came out of that course, I was very, very confident. The slapping a tourniquet on somebody after analyzing what the injuries were and having somebody that was screaming and bleeding and visible trauma was very, very eye-opening and very enlightening.
Absolutely. And the TC3 course, which is the Tactical Medic course, which is again for law enforcement and paramedics already certified, there is an included surgical airway day where we'll actually have live tissue. So, if you have any questions, feel free to contact us at American Medical Academy. If I can give a telephone number.
Yeah, absolutely.
It's 305-271-6555. You can ask for me. My name is Cesar. I'm the Director of Specialties and Continuing Education. And, we have tons of courses we can offer. If you're interested in becoming an EMT or a paramedic or an LPN, feel free to call us. And CPR courses we give there, ACLS PALS, everything. We're a one-stop shop for EMS, and we're more than happy to hear from you.
Guys, we've hosted Cesar in the past. We're in communication with him all times. Any questions, I'll be more than happy to forward them to him, or you can contact him directly. Guys, thank you very much for watching. I'm Tony Torre. This is the Urban Survival Craft Project. This is Cesar Moreton, and until next time, take care.